Good afternoon. If nothing else, please hashtag Fashionista Award.
That's right.
I'm Bob Riney, President and CEO of Henry Ford Health, and I'm thrilled to be here alongside Dr. Teresa Woodruff, the interim president of Michigan State University, and Tellem, the vice chairman of the Detroit Pistons, and they just brought a great coach to the Big D.
I can't comment. I don't know what you're talking about.
And he's obviously the immediate past chair of this incredible conference. And so before we start, I want to just briefly thank the Chamber for the opportunity to spend a few minutes with all of you today about something we're just really incredibly excited about. As you saw from the video, it's a transformative time for healthcare and for us as partners. And Henry Ford Health is leaning into this transformative time and determined with our great partnerships to emerge as one of the nation's best and most contemporary health systems as we move forward. In February, we announced a $2.5 billion vision to create a connected community around our shared headquarters in the New Center or the Midtown arena, supporting the reimagination of our healthcare campus in Detroit and really landing on the future of health will live here. This includes groundbreaking medical research and supporting tomorrow's healthcare advances with an expanded Henry Ford Hospital and a joint research facility with Michigan State that is going to bring the scientific community from around the world and around the nation and create new jobs for scientists and their teams. This is also a repopulation of Michigan's strategy, while developing a community hub with residential housing of multi-income design, dining, retail opportunity, and green space that transforms the New Center area as the gateway to downtown Detroit. At Henry Ford, we believe we have an obligation to elevate health of our communities. Healthy population is a term in healthcare. It requires a holistic view. It means that a true health status of a community requires much more than meeting their physical needs. It requires meeting their mental needs, their economic health, their education health, and their security and safety health. And so when you believe that that is the ecostructure that really creates healthy communities, you think about partners because you can't do it all, you shouldn't do it all, but we have an obligation. So I just want to repeat, health status of a community, physical health, mental health, economic health, education health, and safety and security health. That's the recipe. We've got a great story that really focuses on the power of and in our community. I want to start with you, Arn. We've been official partners since 2017, and our work together really highlights the power of partnerships and what you can dream. And I can't find a professional sports team in the country that has leaned into a community in more a deeper and meaningful way than you. Tell me about your concept of the power in and the partnership moving forward.
Well, it really started a little bit more than 8 years ago before I arrived here in my earliest discussions with Pistons owner Tom Gores when he was trying to recruit me to come here, and we talked about his vision about the impact he wanted to make. And it really set, we were playing our games, as you know, out in Auburn Hills at the Palace. And when I was an agent representing players and visiting the Palace, I'd only seen it at night. I'd never seen it during the day. And my first day on the job, I saw it was just an empty, vacant parking lot in the middle of nowhere to me. And I knew right then we had to move back to the city. But in my discussions with Tom, it really centered on that decision. Should we go back to Detroit, and how do we do it? And the key thing for Tom was, if we do it, it's not just to play games there. We want to build a home and make an impact in the city and participate in Detroit's rebirth and revival. And I talked to everyone that first year as we were exploring the opportunity. And it came down to my man here. Partnering with Henry Ford Health has been our most important partnership. We couldn't do it without partners, and they are the best partner. And really, let me just say why. For a sports team, first, put aside before we get to the greater impact, having the best health care is essential for our players and organization. And they provide the very best in health care for our players and team. And they've been vital to us to keeping our players healthy. Secondly, when we had a home, and we had our negotiation, I insisted in the negotiation that we had a bridge connecting our two buildings. And one was our headquarters, and one was their Center for Athletic Medicine. And they provide not just great athletic medicine for the team, but for the entire community. It's not just for the Pistons. And we wanted it open for everyone to be part of this campus. And really, when we talked about the project, it was if this project worked, and it has, we would go on to a bigger vision. Every city needs a first-class hospital and research center, and that's what this partnership is now doing. We'll have a destination for healthcare that will rival anywhere in the United States or in the world at this place, between Henry Ford and Michigan State. And finally, just for us, it really has been, our whole strategy in coming to Detroit was forming partnerships. We knew we couldn't do this alone. So going to the Power Band, this is the Power Band, this is the Power Band, and everything we've done, this has been the springboard for us to engage with many other organizations in the city through the Power Band. And also, I will say, the hiring of a great coach is the Power Band.
Thank you, Arn. Arn and the Pistons have been an incredible partner to us, and we share the values of our commitment to communities, and that's where all things start. So let's turn to you, Teresa, because we just entered into a 30-year partnership with Michigan State University that we're deeply excited about, and it's going to be about things that people know and perhaps some things that they don't know in the research arena. So help us out.
Well, we're so excited about it as well. A 30-year partnership began about 2.5 years ago, and I want to make sure we give a shout out to Norm Beauchamp, our Executive Vice President for Health Sciences, who is finishing up another session. But he and former President Stanley had a vision that really became this now 30-year relationship almost 2.5 years ago. That was solidified by the $2.5 billion investment that our three organizations have put together to enable all of the health attributes that you mentioned, which I think equates to, if you look at what that pencils out to, is a healthy life expectancy for our population across Detroit and across Michigan. And that's something that we're really essentially about at MSU in our healthcare community. And so we couldn't be more excited by this partnership, the opportunity to really take about all of the work that we're doing in Detroit and really focus it with the Henry Ford and the Piston partnership. Right now, we're working together on a new research building that will encapsulate a lot of new extraordinary cutting-edge science. I'm a reproductive scientist by training and created a field of medicine called oncofertility. So the very first medical practice that has been, and research practice that's been bridged between our universities is in OBGYN. And that's a really exciting new way to imagine the healthcare of the women of Detroit. And ergo, the health of our women and our mothers, that will buoy the health of the entire region. And we have already brought 100 of the Henry Ford research faculty onto our faculty. So we have 100 new Spartan research faculty by this collaboration. And that's a really powerful and I think they all have hats. They all came down. We've been back and forth quite a bit, and that's a really powerful image. We also have about 100 new students between our osteopathic medicine students, our allopathic students, and now a big burst of activity within our nursing community. Really essential to have training happening within that very vibrant Henry Ford environment, collaborating with the kind of work that we do at MSU. So I think these are really exciting times that bridges the built environment in this new research building, the collaboration, the and that comes together when you bring people in together of this kind of a series of organizations, and the expectation that we have for improving the health of the region, not just by 2050, but really each year as we move this collaboration forward.
Teresa, really quick, if you could just tell people how important it is to have a complex, very diverse patient center for medical training?
Yeah, so that for our trainees, to be able to do complex medicine is really essential so that they're seeing all aspect of care, from indigent care to a variety of different care service lines, but making sure that they're seeing complex issues as well as those that you might see at general hospitals. But Henry Ford has some of the most cutting-edge technologies, and in addition to what they have, bridging the Michigan State Facility for Rare Isotope Beams, where we create basically on our East Lansing campus, not just rare isotopes, but isotopes that have never existed on planet Earth and only in the middle of bursting stars, as those isotopes that are now coming into the research pipeline to enable next generation health. And I think if you look back at Michigan State's history and when the decision was made to work in the area of accelerator and particle physics, and then to go after the FRIB facility nationally, there is no other user facility on a campus like ours, on a state university anywhere in America. Otherwise, you have Brookhaven or Lawrence Livermore or Argonne National Labs. We have that on our campus, and being able to create those isotopes that will be the next generation medicine that's going to help our athletes as well as everyone who walks through the front doors, that begins to be a consequential, difference-making, unique, only within this partnership can these students train in these various dimensions.
Thank you. I want you to envision, when this is done, a Henry Ford Hospital medical campus that has all private rooms, that has a state-of-the-art emergency room, new OR theaters to bring in clinicians that can do those rare, complex treatments that only can and should be done in a small number of places. This region doesn't need, but I guarantee you, as you build sooner, we will not need a Cleveland Clinic or a Mayo Clinic to go to. You're going to have it right here where we deserve it to be. I also want you to envision this campus taking on both sides of the Lodge Freeway with parkways, with bike paths, riding paths that connect to the other emerging infrastructure, housing that the Detroit Pistons and Platinum Equity will lead that includes new housing, but also retrofitting buildings like our current corporate office, One Ford Place, into a series of really cool lofts and experience. Envision a hotel that will appeal to the growing patients that are coming from out of state and out of area for care, and then the multiplier effect that will happen as a result of all of that activity. We have already gotten a lot of inquiries about people that just want to do things adjacent to this property. I will place a bet here in front of with my two colleagues. You see these three emblems on these shirts. Give us a little bit, you're going to see a couple more. This is going to have an impact that brings others to the party to infill some really exciting parts of this journey. And maybe just to close, I just want to say that, Arn is very good at recognizing the team at Henry Ford, but his entire team at the Detroit Pistons have been so engaged and so aligned around making a difference. Mike Duggan said yesterday, this is our moment. I think this is our moment in Detroit to think big and act big. Let's dream and accomplish big things. Detroit and Michigan are too great for small dreams or small things. Thanks for your time.
Good job.